A formulary is a list of the generic and brand name medications that your specific insurance plan covers. Sometimes they're also called preferred drug list or preferred medication lists, depending on your plan. The purpose of a formulary is dividing medications up into the price points that the insurance plan covers. So it helps determine the cost of a medication and whether or not it's preferred by your insurance. Formularies also help standardize treatments across plans to make sure you're using the right medication for the right health conditions. Most formularies are divided into tiers, and these are the different levels of medications and their associated costs. So a tier 1 medication is typically going to be a lower cost generic or a preferred medication for a specific medical condition. Tier 2 medications might be higher cost brand name medications or maybe second or third choice medications for a health condition. And then tier 3 are the more cosmetic or more voluntary treatments, or they're highly expensive targeted treatments that need specific indications in order for you to receive them. Higher tier medications are usually higher cost, and lower tier medications are typically lower cost within a plan. Formularies typically aren't an arbitrary process. They involve a lot of different players. So typically there is a team of pharmacists, providers, prescribers, and pharmacy benefit managers that all get together and look at all of the medications, where they fall within the treatment algorithm, the cost, how difficult they are to acquire, and that's sort of how they create a formulary and drop the medications into the different tiers. I always suggest checking your formulary whenever you're prescribed a medication because that helps avoid any surprises at the pharmacy counter. You can see exactly what tier the medication is in and what your copay is likely to be. That way you can have a proactive conversation with your prescriber if the medication happens to be in a higher tier to see if there's a lower tier option that might be less expensive for you. If you're looking for the formulary for your specific insurance plan, there's a couple of ways you can access it. The easiest is usually on their website. Once you log in with your account, you can access the formulary for your specific plan. Now, that's not always easy for everyone to navigate, so you can also just call the pharmacy benefits number on the back of your card, especially if you already have the name of your prescription. They can let you know what tier it falls in and what your copay is likely to be. The other way you can find out where a medication falls on your formulary is to contact the pharmacy. Once they fill the medication, they'll be able to let you know what your copay is, and that'll tell you what tier it falls in. If a medication is not part of your insurance formulary, it's not likely to be covered, and so that means you'll likely have to pay out of pocket for that medication. Now, there are some exceptions to this. Sometimes you can talk with your prescriber and file an appeal to have a medication covered if there's a specific medical reason why you need it, even if it's not on your formulary, but it definitely means you're going to have to jump through some extra hoops in order for the medication to be covered. Keep in mind that when your prescriber writes a prescription for you, they're looking at the best medication that meets your needs based on their practice. They're not always thinking of cost and accessibility, and that's where the formulary comes into play. So you need to be an advocate for yourself, and if a medication falls into a higher formulary, you can proactively ask your prescriber if there's an equally effective option that falls into a lower tier on your plan to help save you money.